welcome and good morning to everyone. My name is Michael Kennelly. I'm a practicing urologist from Charlotte, North Carolina in the United States. And as we've touched upon, one of the key areas when we're dealing with patients who have neurogenic bladder with intermittent catheterization is urinary tract infection. As was stated before, 2.7 times a year, patients have UTIs. Now, there's many factors that go along with that. And what we want to do during this session is with some of my colleagues is kind of have an open discussion dialogue. And when we do that, we're actually going to involve you. So we're going to bring you in, and there'll be times where we're going to poll and ask questions, and we'll get to that. But I think the key aspect is, remember, we're here to try to improve the patient's lives. Over the last year, myself and my colleagues on the table with the assistance of Coloplast and some of our other colleagues have been working on a risk factor model, specifically what some of the risk factors are. And sort of the fruit of that labor has been the actual sort of manuscript that has been published in Advances in Urology. And really what we spent time on looking was really to get a review on the risk factors. Andre, who's kind of looks at the overall aspects of things, may have more of a different view. And I think when it gets to sort of bowel function, urologists tend to have to manage the bowel because they oftentimes don't have a primary caregiver. And Andre, can you speak to sort of bowel function and in regards to this gentleman, what may be an option to improve things?
As physiatrists, we're looking on whole body function, an idea of physiatry to make patient better, comfortable, whatever dysfunctions he has. And definitely bowel dysfunctions we identified in our general medical condition in our review as one of the biggest contributors to the urinary tract infections. Fecal incontinence, constipation, prolonged difficult time to evacuate bowels is a big issue for our patients. And we not often talk about this at home. Sometimes we even don't like to talk with our children about how you poop today. Are you happy or not? But question to you actually, how often you discuss questions about bowel management with your patients? And choices are never, only upon request of the patient, or on every visit of patients. And impressive, green predominant color in the audience. Great. And it's a very challenging issue to discuss. And
I'm very impressed with that.
yes, absolutely.
It was almost a sea of green. That's phenomenal.
Fantastic. We're in a good place. Yeah.
Well, how would you assess it? I mean, as a urologist, assessment tools that we have, other than just asking, how often are you doing it? What management style are you doing? Is there a tool that you use?
So first of all, as physiatrists, from the day one of admission to rehabilitation center after the acute spinal cord injury, one of the goals before discharge home for our patients to establish bowel routine. And it's a very complex questions. What you will eat, how much you drink, what kind of activities you can do, what kind of medications you will take in order to support your successful bowel routine. And unfortunately, as we know, there is not a lot of clinically routinely used tests. For example, we can send patients for colorectal manometry. Not all hospitals have it. And then it is one of the challenge. Therefore, typically in the present time, we based our assessment of patients' quality bowel routine using validated questionnaires. And one of them is neurogenic bowel dysfunction score, which is a well-validated. It actually was created in Denmark. Dr. Klaus Krok and his team was very successful in preparing this questionnaire, and I'm using it a lot. And actually, it's one of the recommended questionnaires that has to be included in clinical trials when we are assessing bowel dysfunctions in people with spinal cord injury.
So that questionnaire, you can actually use it at the beginning, and then you can assess progress, so it monitors over time?
Exactly. You can actually see if score decreasing, the highest score suggesting a very bad bowel management protocol. One of the questions there, how long is your bowel routine? And we do know that some of our patients have up to 2 hours to spend in order to evacuate their bowel, which is enormous time. Can you imagine 4 to 6 hours a week you are in a toilet? That's why by decreasing the time, dramatically could decrease the neurogenic bowel score dysfunctions and show progress of the patient.
Just as a show of hands, where the green will be yes, orange will be no, how many people in the audience utilize the neurogenic bowel dysfunction questionnaire with their patients? So green is yes.
Yes. Okay.
So it's probably 50-50.
50-50.
So that may be something to look at and discuss during this session.
Perfect.
Excellent. There are many, many risk factors other than just the catheter or instrumentation. As you go through individually, the general conditions, looking at diabetes, looking at their overall health. We didn't really talk about the female aspect of things regarding postmenopausal females with possible use of estrogen, but various things to look into. The local conditions, whether they're stones within the bladder, whether they've got thick-walled ischemia within the bladder, other things of their technique, educating within that process of the proper catheters of using it, and then also education of the patient. These are all factors that really take, as we've said, a holistic approach to really optimize the patient's use. What we've been able to accomplish is become a holistic approach. I mean, that's what we all want. We want to use kind of a holistic approach to try to improve the quality of lives within our patients. And I think that's what kind of this forum is setting up. This is what we're starting to do and getting everyone together. And so the next day and a half, we're going to be really focusing in on that. So I'd like to thank my panel for their comments, guiding me through this.